We've learned about the definition of what is health promotion. We've talked about ways that we can modify behavior. Now let's really talk about one specific health area we might want to modify, and that is childhood obesity. And we've seen that there's a framework in place for us to work within the communities to impact childhood health. Marcia, tell me, what is the prevalence of overweight and obese adults and children in the U.S.?
For adults, we saw a rapid increase from 1985 to currently. In 1985, the rate of adult obesity was 15%. Now it's 35%. For children, during that same time period, childhood obesity rates in every age tripled.
That's horrible. And how does Georgia fare relative to the other states on those same statistics?
Georgia actually ranks worse than other states in the United States. Georgia ranks number 37 for adult obesity and number 47 for childhood obesity.
And what is the reason that Georgia is faring so poorly?
We have in the South a love of fried foods, sugar-sweetened beverages, and we're not very active. And additionally, there are health disparities. Children who are minority, from low-income households, and who live in rural areas are most likely to be obese.
Well, I imagine there are huge health implications for our poor ranking in this area. What would some of those outcomes be?
For children, we are seeing in children what diseases that we used to see only in adults, such as hypertension and diabetes. 1 in 3 children born in the year 2000 will develop diabetes in their lifetime. And for the first time in a generation, it is predicted that children will have a shorter lifespan than that of their parents.
That is amazing. And the economic impacts?
Currently in Georgia, the direct health care cost related to obesity is $2.5 billion. With a projected increase in obesity, those costs in 2018 will be $11 billion.
Can you tell me about some just very basic nutrition and physical activity changes we could make so that this trend does not continue?
We need, both as adults and children, to eat more fruits and vegetables, have them available and accessible in our household. So for parents or grandparents, it's easy to have a bowl of fruit out where children can just take a piece of fruit and grab it and eat it. We can find opportunities to be physically active with our children, go out, play with them, take a walk. We can eat more whole foods. Live off the garden, live seasonally, which also saves cost.
Well, we heard from Emily that Colquitt County has identified already hypertension and type 2 diabetes in their children. What are you doing to work with Colquitt County to address some of those issues?
I know while these statistics are very alarming, we have a lot of knowledge about what to do to transform those trajectories, and we're doing exactly that in Colquitt County. We are working in after-school programs to increase physical activity of children, engaging families in the knowledge of providing healthy choices and opportunities for physical activity at home, and working with what's already going on in the community in Colquitt for access to fresh fruits and vegetables and walkable trails.
Wow, those sound like some great opportunities and activities. So after the break, we'll show a graphic example of some simple behavior changes you can make to improve your health. We're back with Marcia Davis, and she's got a very simple demonstration to show us at least one way that we can modify our behavior, improve our health. Marcia, what do you have here?
What I have for you is something we could do in health promotion and behavior is to provide you knowledge and alternatives for simple behavior changes that you can make.
Okay, I'm willing.
How about eating a pack of sugar?
Oh gosh, I don't know. I don't typically eat packets of sugar, so this is not a sugar substitute. This is a real packet.
No.
Okay. Well, all right. For the demonstration only, and for you. Wow. I don't remember this from my younger days at all. Wow. All right, so that's about half the pack. Wow. That is really sweet. Let me get through the other half. Here we go. Okay, I've done it.
Now I would like you to have 16 more.
No way, Marcia. There's no way that I can eat 16 more packets of sugar.
And not to put you on the spot, but do you ever have soda or soda for your children?
Sure. In our household, we serve soft drinks all the time.
A question for you then. If you're not willing to eat 17 packs of sugar, why are you willing to drink a soda or offer it to your children? Because there are 17 packs of sugar in a 20-ounce sugar-sweetened soda.
Get out. So you're telling me these are teaspoons, there's 17 teaspoons in every soft drink?
Yes.
Are there any alternatives here?
Well, a much healthier alternative for you and your children is water.
Well, I can tell you right now, sorry kids, but there will be no more sugar-sweetened soft drinks in our household. Well, Marcia, we've talked a lot about healthy food choices, and you've given us a great demonstration, although it didn't taste very good. But now I want to switch gears and talk about physical activity. What can we do to start pulling our children away from the television and video games and get them out there to be active?
Children are naturally active. They do love to play. We, as adults in their lives, need to give them that opportunity. We need to be the ones that put limits on the amount of time they spend before the screens in their life, television, computer, video games, and provide them opportunities to go out and play.
And what are some of the opportunities that you're thinking about here?
Anything to be active, walking, running, playing basketball, throwing the ball, just moving.
Well, you know, I think it's easy for us to say that if you have the means to do those things with your kids, or if you live in safe neighborhoods where you've got access to playgrounds. But what do you say to those families who live in unsafe neighborhoods where they don't necessarily have a playground on the street corner?
Well, I would say that there are other opportunities for children to be physically active in school and in after school. And I think parents should be advocates for increasing physical activity time in schools and after schools. As well, we are working to make communities safer and more walkable.
Well, I know that healthcare reform legislation that passed earlier this year has some important language in that legislation that specifically addresses what communities can do and provides them funding to increase bricks and mortar around physical play spaces for kids.
Yes, it's a great opportunity to provide an environment that children can be active and play.
Well, thank you, Marcia. You've given us some really good ideas on how to improve our nutritional habits and also some ways we can get our kids to go out there and be more active so they can grow up to be strong and healthy adults.
You know, Phaedra, that was really helpful to me and encouraging to see, what changes we can make in our lifestyles. I will say now, inspired by this on camera, that I was a sugar drink addict for many years. I guess it started in grad school. But I actually have cut that out already. And now I see some other things that I could do.
Well, you know, the field of health promotion is all about behavior change. And it seems like cutting out those sugar drinks is such an easy first step to improving your nutrition.
Well, in our other PHI episodes, we've now covered laboratory science and statistical science. Now we're going to health promotion, where we see these day-to-day changes that we can make.
You know, our next episode, Sham, will be focusing on health promotion as well and how we can impact or change our risk factors around injuries, such as putting a seatbelt on to avoid injuries associated with car crashes.
So look in your TV listings for PHI, Public Health Impact.